Good evening, everyone. We'll start by 4:05. We're just waiting for more participants. Good evening, everyone, and a warm welcome to all of you joining us today for our World Stroke Day webinar 2024. I am Ankita Gill, Assistant General Manager in QAI, and it is my privilege to be your moderator for this exciting and impactful session. This year theme is leveraging the emotional power of sport to raise awareness about stroke. We will explore how sports can drive action towards prevention, recovery, and community support for stroke survivors. We are also aligning with the hashtag greater than challenge, a global call to become stronger than the challenges stroke poses by adopting healthier lifestyle and fostering community action. Together, we will celebrate the spirit of resilience and prevention. And we have an excellent lineup of speakers who will share their expertise and stories. I'm sure their insights will inspire all of us to take action, whether in our personal lives or our healthcare initiatives. Now, it is my privilege to introduce our distinguished panel of speakers for today. We have Dr. Kumar Velu, Professor and Lead Consultant from Esther Ramesh Hospital, Guntur. Professor Dr. Rajendra K. Dhameja, Director of the Institute of Human Behavior and Allied Sciences, New Delhi. Dr. V.G. Pradeep Kumar, Senior Consultant Neurologist at Baby Memorial Hospital, Kozhikode. Dr. P. Vijay, Director of Akinedu Stroke Center, Guntur, who will be highlighting the importance of women in sports and stroke awareness initiatives. Dr. Arvind Sharma, Head of the Department of Neurology and Stroke Specialist at Zydus Hospital, Ahmedabad.
Hello.
Mr. COO of Apollo Hospitals, Ahmedabad. So I would like to welcome all of them. With their expertise, we all are hoping to learn a lot from them. And first of all, with this, as per the program schedule, I would like to first give the presentation of introduction to our participants. Let me share my screen first. I hope everyone can see my screen. Yes. Introduction to QA. QA is an accreditation body. Operation started from August 2017. We are the fastest developing accreditation body in the world. We have around 17 programs, 17 accreditation standards, which we have developed in the 7 years. That is why we are the fastest developing accreditation body in the world. Our organization structure, we have different divisions with us, which is CET, Center for Education and Training, CAHSC, NCIA, and CAABA. Our different programs for CIA, international accreditations for Center for International Accreditations, for Center for Laboratory Accreditation. Our chairman is Professor Vikram Kumar, former director, CSIR National Physical Laboratory. We have different programs under this as a medical laboratory, the testing laboratory. We have medical laboratory as per ISO 15189, ISO IEC 17025, general requirements of competence of testing and calibration laboratories, certification of medical laboratories as per the Clinical Establishment Act, and accreditation of calibration laboratories as per ISO IEC 17025. Biomarking accreditation, we have ISO 20387. We have accreditation of inspection bodies as per ISO IEC 17020 conformity assessment. Also, we have accreditation of proficiency testing IEC 17043 and accreditation of reference material producers as per ISO 17034. The number of accreditations in CIA, we are very glad to inform that in our testing laboratories, we have 81 accredited sent testing labs with us and 14 medical labs, 4 calibration and 3 biobanks. Also, in our past journey, the trend is saying that we are increasing year by year from 59 to 112. We have increased this year as an accreditation body. Center for Accreditation of Health and Social Care, the board chair for Professor MC Mishra, who is a former director of AIMS New Delhi. We are also having different programs other than hospitals. We have ambulatory care facility, home health care, transition inpatient rehabilitation, telehealth, hotel and home stays, dialysis center, ART, IVF, emergency department, green healthcare facility, patient safety, WHO, PSFH, primary and advanced stroke centers, vision centers, QA 7101 plus, and recently launched medical transport organization ambulance services in progress is bone marrow transplant and hair transplant clinic. So we are soon going to launch these standards, accreditation standards for other healthcare organizations. For the accreditation in many years of CHSC, we have grown again in 124 for 2024, and soon in next year we are hoping to get more from the last year, every year. The number of healthcare accreditation in 7 years, this is different for different accreditation programs. International recognition. So yes, QA becomes the first accreditation body in India to achieve ISQA EEA accreditation in less than 5 years of operation. And we are also QA accreditation with Ministry of Health, central government, CGHS for private hospitals, IMS centers, medical centers, and imaging centers. QAI CIA is a full member MRA signatory of the Asia Pacific Accreditation Corporation, APAC. Also, we are ILAC, International Laboratory Accreditation Corporation. This is our accreditation mark, your accreditation mark. This is our gold seal, which we provide to all the accreditation hospitals, healthcare organizations. These are our clients. So I will be running through the slides because we have limited time. So I will not be naming. So we have under ART, IVF, different centers, different pioneers in healthcare. We have in home healthcare. We have a dialysis center. We have WHO patient-friendly hospitals, patient-safety friendly hospitals. Then we have emergency department accreditation programs under which these are the hospitals, healthcare organizations which are already accredited. Ambulatory care facilities, some dental, some medical imaging centers. Hospitals, small hospitals and certifications. We have again small hospitals and certifications. Then we have telehealth facilities. Then we have transition care centers. Also, we have advanced stroke centers. Again, advanced stroke centers. Primary stroke centers we have. We have clinics as well, which is from Mongolia. We have many vision centers accredited by us. Many vision centers in line. Then we have QA 7101 plus. So these are all the hospitals, healthcare organizations which are accredited by QA and have gold seal as well. So talking about geographical spread, so we are already spread in different countries, and now we are in work of progress with many other countries like Congo, Oman, Kuwait, Uzbekistan, Georgia, and Canada as well. So these are the countries which we have already reached our awareness and our QAI, which is India, Nepal, Qatar, Bahrain, UAE, Maldives, South Africa, Ghana, Myanmar, and Bangladesh. So thank you so much for listening to me patiently. Going forward with our schedule. So with our schedule going forward, now I would like my colleague, Ms. Sakshi, to please share a quick poll, and I would like you all to participate so that we can get your thoughts on stroke awareness and prevention. So this poll is a small poll which is going to raise awareness. As you can see, everyone, the questions are there, and I'm sure you all know about it. But this will give us an idea that exactly what participants we have. So let's go for this quiz. These 10 questions, which is very simple. I would like you all to answer. I hope everyone can see on the screens. Sakshi, will you confirm us that yes, we are receiving some answers? Yes, we are receiving. Most of the people are saying the right thing. Yes. So 25%, I would like to say a few of the answers. 25% of the people are saying that strokes are preventable with lifestyle changes and medical intervention. What percentage of strokes are preventable with lifestyle changes and medical intervention? It's 25%. So you'll get the answer when you will do it. And it's more than that actually. Which of the following is a common symptom of stroke? Sudden confusion or trouble speaking, gradual memory loss, high fever, persistent cough. The sudden confusion or trouble speaking, that is 50%, and gradual memory loss is 50%. So I'm giving some kind of idea to our speakers as well that people may would like to know more about it, and they definitely need more awareness on this. So stroke only affect older people, myth 100%. So I would like to end poll now, not taking much time, and we will be also listening about fast technique because most of the people have said pace, awareness, strength treatment, which is something different with the reality. So let me end this poll and then we'll go with the speakers. Thank you so much for participation. Going forward, now I would like, and this is an honor to have two distinguished keynote speakers with us today, Dr. Mavelu from Mr. Ramesh Hospital, Guntur, and Professor Dr. Rajendra Kidhameja, Director at the Institute of Human Behavior and Life Sciences. So they will discuss about how sports can be powerful tool for stroke prevention and rehabilitation. So let's welcome Dr. Kumar. Will share insights first, followed by Dr. Dhameja. Thank you. Dr. Kumar Velu, you are available here?
This is Dr. Vijaya, available.
Yes,
Hello.
Dr. Vijaya.
Yeah, good evening, everyone.
Good evening, good evening.
Good evening.
So I'm requesting Dr. Kumar Velu, as per our program schedule, he will be starting as a speaker. So
Okay.
are you there? There is some loss of connection. Let me get back to you just a second, please. Yes, sir. Please.
My slide is my this thing.
Yes, sir. We can hear you.
Again, I'm just looking at the screen sharing. Is my
Yes, we
slide?
can see your screen.
My slides are seen?
Yes, sir. I can see your slide.
Fine. Is it full screen?
It is full screen, sir.
Right. Good evening, everyone. Sorry for this 30 seconds fiasco before I could load on this thing. As Ankita has already introduced the topic, you'll see that today is World Stroke Day, 29th October. The theme for the Stroke Day is let us be greater than stroke. World Stroke is 29th of every year. It's an annual focal point for stroke awareness activity around the world. The campaign highlights the importance of stroke prevention and encouraging us all to take steps to be greater than stroke. Now, the bare facts are it's a leading cause of death and devastating illness. 1 in 4 people will suffer from stroke in their lifetime. Every 3 seconds, someone somewhere is struck by stroke, and every 6 seconds, one succumbs to stroke. It means over 12 million people suffer from stroke every year. Of this, 6.5 million people will die. That shows the gravity of situation that we should. Now, for the stroke survivors, the effects can be devastating. Families are shattered, life changed forever, and yet stroke remains a silent epidemic. Desperately needs a louder voice. That's what we are trying to attempt. Hope remains as actually 90% of strokes could be prevented by addressing a handful of manageable risk factors, physical inactivity being one of the top stroke risks, and increased public awareness, we can be greater than stroke. Seems to be stuck. Yeah. World Stroke Campaign this year will be leveraging the emotional power of stroke to raise awareness, encourage action on stroke prevention and rehabilitation. So, universal trans geographical and demographic from all walks of life, sports in some form. By leveraging sports as a platform for awareness, we believe the message will reach a wide and diverse audience. This is the message from the World Stroke Organization. Now, coming to stroke and exercise, 1 million strokes a year are linked to physical inactivity. By getting the recommended amount of exercise each week, you will reduce your risk of having a stroke. Just 30 minutes of exercise 5 times a week can reduce our stroke risk by 25%. Exercise plays an important role in reducing several stroke risk factors, including hypertension, diabetes, high bad cholesterol, depression, and stress. By getting regular exercise, you can take action on a number of stroke risk factors. Now, I'll just show one of the patients who had re-stressed with stroke and how we could leverage her out by doing appropriate measures. You can see the facial involvement on the right side. In this, you can see the right upper limb just not able to sustain the weight and falling down. And post-injection, you can see the response within an hour to this patient. This patient was fortunate. You can see the face being normal, and she is able to lift both the hands and she could talk normally. So, with all this thing, having said this thing, let us prevent a stroke of which 1/3 will have severe deficit and 1/3 will. So, let not our stroke victims have such a gloomy outlook. Let them have a beautiful roadmap ahead. Thank you.
Thank you so much, sir, for this wonderful presentation and giving us a lot more on the theme. Now, I would like yes, so we don't have a preacher today because I have received some message of his some other duties. So that's okay. We can go forward with the program schedule. And now I would like Dr. Vijaya. She is the director of Accreditation Stroke Center Guntur that she will highlight the role of women in improving stroke awareness through sports. So, Dr. Vijaya, over to you. Ma'am, you're on mute.
Good evening, everyone. Thank you. And good evening, sir, Kumar Velu, sir, for that nice introduction. I think it's a very positive theme this year. Not only it is sports, and in sports, we know Indian women and men both have contributed very significantly to bring glory to the nation as well as inspiring all the youth. Stroke is a brain attack, and we know it can strike even young people, more so in India. And we can understand how a 30-year-old or a 40-year-old young person, man or woman, if they get a stroke, what is the thing that they go through? So to encourage them that life is not over and life can be regained, I think we can use the sports persons as leverage to inspire them. Not only in physical fitness as a form of prevention, but also recovery. We know many of our famous players like PV Sindhu, Mary Kom, and PT Usha, and even the Karna Malleswari, who is the first person to break the Olympic glass ceiling. All of them must have put in so much of effort, and despite injuries, despite the negative things surrounding them, they persisted and won. Similarly, the same team spirit or a spirit of the games should be inculcated in the stroke survivors so that they can also fight stroke and come out as victorious. This is a theme that we have taken up, one of the aspects. The other aspect is how to use this in the prevention. And this year's theme is physical fitness or physical activity. We have been doing the stroke awareness activities along with even Kumar Velu sir was there with us yesterday for the last 10 days in our institute. And one of the themes that we have been propagating is 30 minutes physical activity every day can prevent many of the strokes and even other cardiovascular diseases. This has been very humorously been explained to the patients and attendants and caregivers today also. And one of them asked, because I have so much of knee pain, I cannot walk, madam. Because I am old, I cannot walk, madam. And similar things. I said there are so many causes not to do. But there is only one reason that you should do, that is to prevent stroke. Just imagine if you get a stroke, even if you wanted to walk, even if you wanted to run, you cannot do. You will lose that power forever. So never get in yourself in that position. You please keep yourself active at any age. You should be able to do 15 minutes morning and 15 minutes in the evening. Therefore, it will make 30 minutes. 30 minutes every day is doable for anybody, and everybody should be doing this. The other advantage that we have told the younger people is choose a sport, whatever you like. You revive your child within you, and then get that interest either in this TT or badminton or shuttle or anything, tennis, football, basketball, choose any sport and then play for 30 minutes. And dance is another form of physical activity, which is both, it is advantageous as well as it is enjoyable. So I think this is a very simple message for this year for the public. Keep yourself active at every age and stage of your life. 30 minutes you should spare for yourself, and that will keep stroke away, which is a major disabling disease which can affect anybody at any stage. This is how we have gone ahead this year, and I would like to hear others' experiences in this. And thank you, QAI, for giving me this opportunity. If there's anything in the panel, I will again talk. Thank you.
Thank you
Hello,
so much,
Sakshi?
Dr. Yes, I can hear you, ma'am. Ankita
Hello,
this
can you
side.
hear me?
Yes, ma'am. Thank you so much,
Okay.
Dr.
I
Vijaya.
hope I was heard and it was relevant. Yes,
Yes.
yes. Thank you.
I really like the point that to choose a sport. And because back days then when we used to play and we used to enjoy the sport, nowadays don't get time to put out the time at this point. But absolutely, giving time to your sport and play with enjoyness, and all the stress and everything will go off. That's a very good point. I liked it a lot. So going forward, I would like to invite now the other panelist, Abid Sharma, who is the head of neurology at Zydus Hospital, Ahmedabad. He will be sharing inspiring case studies from stroke survivors demonstrating resilience in the face of adversity. So, Dr. Abid Sharma, I would like you to speak, please.
Hello, you are able to hear me?
Properly.
Yeah. I'm sorry, I'm out of country at present, and I thank QI to arrange this program as the Secretary of Indian Stroke Association. I really thank the QI to put this initiative, and I thank my President-elect, Dr. Vijaya, for speaking so wonderfully about the young stroke, and Dr. Kumar Velu, who's the esteemed member for ASA, is speaking about really good. So about the stroke awareness. So I'll just give you one picture of mine. I'm walking and talking to you because I'm with the group. So I'll just let you know what Ankita has told about the sports. I'll tell you one. If you're not able to hear me, Ankita, please let me know, right? So,
Yes, sir, sure.
so the story which I'm talking about is about the young CEO, 36-year-old, and had a difficulty in speaking and one-sided weakness, right-sided weakness. So the problem is, as he was a CEO, he was not able to understand the thing initially when he had a stroke. So he went to a psychiatrist, and very wild weakness in one right upper limb. So he went to a psychiatrist for the speech that he's not able to understand and able to speak. So as he CEO, psychiatrist has given him a clonazepam. And subsequently, I cut this story short. He was having a aphasia where there was a acute language difficulty because of the stroke. So when he came to the neurologist, the time is already gone, golden window is gone. And there are only 10% of strokes in India. It is even less that they reach on time of the golden window. So he came to the neurologist, we did the MR and found a MRI brain where we find the stroke in this patient. And the story doesn't finish here. As we're talking about the physical activity and the resilience which this patient has brought with his weakness and the aphasia, he has to join the office again. As he's CEO, it's very difficult that he's not able to understand or speak and not able to write with the right hand. It was very difficult for him to join. So he went for a physiotherapy and a speech therapy. And it has been said that it is not that in 6 months only that you recover all the symptoms. This patient in 3 months developed his language back and his weakness back, and he still is a CEO of that company with his resilience and with his all the physical activity he did and physiotherapy he did. So not every stroke reach on time and reverse the paralysis. So we should understand the importance of physical therapy and occupational therapy, which is very important after the stroke. And brain is not like that. After 6 months, you are not able to recover fully. People are there who recovered in 2 years also after the stroke with the good physical therapy. And so that is called as in neurology as a neuronal plasticity. The other side of the brain, see, heart is one. Brain is divided with the corpus callosum in the right and the left. So here, that is the most important thing, the neuronal plasticity, which is important for the rehabilitation after the stroke. So I would like to say that there are two ways of, one is to prevent the stroke, as Dr. Vijay has told, that we do a physical activity for 30 minutes. It is not that the sport is always important. If you walk 30 minutes, it's good enough. And any activity which is good for you, you can do it. And after the stroke also, the physical rehabilitation is very important in the form of occupational therapy, which I would emphasize that you should do it. I thank again QI for inviting me as a panelist.
Thank you so much, Dr. Arvind Sharma. I know that you are with group and you have already told me, but I appreciate that you have taken out the time and joined us on this webinar. Thank you so much for this.
Thank you. Thank
Okay.
you. I'll
Thank
be
you,
there.
sir. Okay, sir. So going forward now, I have something good. We have gathered some video messages from healthcare centers across the country showcasing the initiatives of stroke awareness. So let's watch these inspiring clips that show how health can hashtag greater than stroke. So I would request my colleague Sakshi to play the video, please. Sakshi, voice is not coming. Can you please try it again? Sakshi, we cannot hear the voice. Please check it once again.
All of you. This is the team from Advanced Stroke Center, Sri Ramakrishna Hospital, Coimbatore. This is to create awareness. B, losing balance, blurring of vision. F, drooping of the face on one side. A, drifting of the arm. S, slurred speech. T means time to call ambulance, because 4.5 hours is the window period. We can start thrombolysis and thrombectomy, cure the stroke. Thank you.
Greetings from Apollo PG's Hospital, which is an advanced stroke center accredited by the QAI. We have used sports and physical activity in form of climbathon, walkathon, marathon and yoga in raising awareness in prevention and treatment of stroke.
We are from Master Ramesh Hospitals, Guntur. On the occasion of World Stroke Day, we want to emphasize
that sports is greater than stroke. To emphasize the same, we attach a video clip.
This video is to highlight the impact of sports to drive awareness about stroke prevention and rehabilitation. One should have keen interest to prevent stroke by doing exercises such as cycling, running, walking on regular basis. These activities are very important for the stroke prevention. Thank you.
Namaste. Hello to all esteemed ISA members. I am Dr. Arvind Sharma. I am Secretary for Indian Stroke Association, and on behalf of Indian Stroke Association, I want to congratulate all of our ISA members who are planning to create awareness for the World Stroke Day, 29th October. As Indian Stroke Association initiative, now last many years, we are creating awareness for whole month. And I would like to mention you that this year our theme is Mission Brain Attack, to create awareness among the physicians, among the patient, among the lay people about the symptoms and the treatment for the physician, those who can treat at the peripheral center. So for this initiative, this month in October, there is a planning for having more than 12 programs across India, and it is really very heartening, and I congratulate all the stroke neurologists or IEC members who are planning to do this and to create awareness for the physicians and the nurses and the physiotherapists, and we are very encourage this month for all the stroke neurologists who want to do this program. So the main initiative for Mission Brain Attack is symptoms and the treatment. And the treatment part, where we are empowering our physician to treat stroke, is to create more and more primary stroke centers for the accreditation. As we have started the accreditation of stroke for primary and advanced, we are doing advanced stroke centers a lot. We want with this initiative to train and empower physician to treat and do thrombolysis for the stroke. So I once again congratulate our esteemed members and our whole EC and the President, Dr. Nirmal Surya, and we love to have the programs in the whole month of the stroke month, and looking forward to try to attend all the programs, and if not, wishing you all the very best for giving a great program for this World Stroke Month. Harega Stroke, Jeetega India. Namaste, Jai Hind.
Thank you, all the healthcare organizations who have shared their wonderful videos with us. We have seen a lot of enthusiasm and very creative people in healthcare who are coming up with exercises, dance, and other different methodologies of doing the awareness and taking the right, saying the right thing to the right people. Thank you so much for their participation. So now, as we come to the end of today's webinar, I would like to thank our all speakers, panelists, and attendees for their participation and valuable contribution. A special thanks to my team and our speaker for setting the tone for today's discussion. And before closing this session, I would like to take a beautiful picture for all of us to remember. So I would like my colleague Sachi to please do the honors and take a good, beautiful picture for all of us. I would like if people can come on camera as possible.
So on the count of three, 1, 2, 3, everyone smile. Thank you so much, Ivan.
Thank you so much, Dr. Vijaya, Dr. Kumar Velu, Dr. Arvind, and everyone who has participated, all the participants here. Thank you so much for being here. And I would tell all of you, thank you for all joining once again. And let's come to raise awareness and be after So have a great day. Thank you so much.
Thanks, Ankita. Thanks, everyone. Thank you, ma'am. Thank you, Sakshi.
Thank you so much, sir. Thank you so much, ma'am.
Dr. Ashokan sir, if you are there, hello sir. And thank you, Kumar Velu sir, and thanks, Ankita.
Thank
Our secretary, Arvind Sharma, who is always a very dynamic person.
He's
And
still on
Sakshi.
his feet. At the moment, he's on his feet.
He's still on his feet.
No. He's walking, no? He's walking briskly.
I know. Okay.
Thank
Very
you.
good. I think they are having a walkathon or something. I know. Okay, it's been this time theme was very enthusiastic for everybody.
Yes,
Everybody's
absolutely.
walked and this. We'll all share. Okay. Thank you.
Thank you, ma'am.
All the
Thank you,
best. Bye.
sir. Thank you.